Title: Lorazepam, Uses, Side Effects and Hidden Risks You Must Know. Did you know that a small pill used to calm anxiety can also become dangerously addictive if misused? Today, we're going to explore Lorazepam, a medication widely prescribed for anxiety, panic attacks, and sleep problems. While it can be extremely effective, it also carries serious risks that many people are not fully aware of. If you or someone you know is using this medication, or thinking about it, this video will give you everything you need to know. What is Lorazepam? Lorazepam belongs to a group of medicines called benzodiazepines. These drugs act on the brain and central nervous system to produce a calming effect. Doctors commonly prescribe Lorazepam for anxiety disorders, panic attacks, short-term insomnia, seizures, especially emergency control, sedation before medical procedures. One of its key advantages is that it works quickly, usually within 20 to 30 minutes, making it very useful for sudden anxiety or panic episodes. However, because of this fast action, it also has a higher potential for misuse. How does Lorazepam work? To understand Lorazepam, we need to talk about a chemical in the brain called GABA, gamma-aminobutyric acid. GABA is responsible for slowing down brain activity. Think of it as the brain's natural brake system. Lorazepam enhances the effect of GABA. As a result, brain activity slows down. Nerve signals become less intense. The body feels relaxed. Anxiety levels drop. This is why people feel calm, sleepy, and sometimes even emotionally numb after taking it. But this calming effect can also become a problem when the brain starts depending on the drug. Common side effects. Like all medications, Lorazepam comes with side effects. The most common ones include drowsiness, dizziness, fatigue or weakness, confusion, especially in older adults, memory problems or forgetfulness. Some people may also experience poor concentration, slurred speech, lack of coordination. These effects can interfere with daily activities like driving, working, or studying. That's why it's important to use this medication carefully. Serious risks and warnings. Now let's talk about the most important part, the risks. 1. Dependence and addiction. Even when taken as prescribed, Lorazepam can lead to physical and psychological dependence. This means your body starts needing the drug to function normally. Over time, you may feel like you can't relax or sleep without it. 2. Withdrawal symptoms. Stopping Lorazepam suddenly can be dangerous. Withdrawal symptoms may include severe anxiety, restlessness, insomnia, sweating, tremors. In severe cases, seizures. This is why doctors always recommend gradually reducing the dose, rather than stopping abruptly. 3. Respiratory depression. One of the most serious risks is slowed or stopped breathing. This can happen when Lorazepam is combined with alcohol, opioid painkillers, other sedative medications. This combination can be life-threatening and even fatal. 4. Cognitive and memory problems. Long-term use can affect your brain function. Some people experience memory loss, reduced focus, slower thinking. This is especially concerning in elderly patients. Who should avoid Lorazepam? Lorazepam is not suitable for everyone. Extra caution is needed in elderly individuals, higher risk of falls and confusion. Pregnant women, can affect the baby. People with liver disease. Patients with a history of drug or alcohol addiction. Individuals with breathing disorders. Always consult a healthcare professional before starting this medication. Safe use tips. If you are prescribed Lorazepam, here are some important safety tips. Take only the prescribed dose, never increase it on your own. Avoid alcohol completely. Do not drive or operate heavy machinery after taking it. Use it for short-term treatment only. Never stop suddenly, always taper under medical supervision. Also, consider non-drug approaches like therapy, relaxation techniques, and lifestyle changes. Lorazepam can be very effective when used correctly. It can provide quick relief from anxiety and distress. But it is not a long-term solution. Misuse can lead to serious consequences including dependence, withdrawal, and even life-threatening complications. The key is awareness, responsible use, and proper medical guidance. If you found this video helpful, make sure to like, share, and subscribe for more informative medical content. Stay informed, stay safe, and take care of your health.